In this lecture, we'll talk more about the electronic health record and meaningful use or promoting interoperability and MACRA. Some questions to keep in mind as we go through this lecture. What is an EHR? Why were they implemented? Is there a difference between EHRs and EMRs? What do you think are some advantages of having or using an EHR? And what is meaningful use or promoting interoperability? Why is it important to you? An EHR is an electronic health record. It's the digital version of a patient's paper chart. Documentation can occur in real time and contain beyond standard clinical data. Some benefits of the EHR. So like I said, it's real-time and patient-centered. They can contain a patient's medical history, diagnoses, medications, treatment plans, immunizations, allergies, radiology images, lab and test results. EHRs also often come with built-in evidence-based tools that providers can use to make decisions about the patient's care in the moment. So they're able to access the latest data on that person's diagnosis or their issue and treat accordingly. And it allows providers to automate and streamline their workflows. The impacts of EHRs on care. Improved patient care, improved patient participation because they're able to access a lot of their own records, improved care coordination between disciplines, improved diagnostics and patient outcomes, practice efficiency, and cost savings. Obviously, as we discussed in previous lectures, with the initiation of EHRs, this was not always the case. There was a lot of resistance, a lot of unwillingness to change, but now we can see all of these improvements with the advent of EHRs. So information on the patient is accurate, up to date, and complete usually in an EHR. It enables quick access to patient records for more coordinated, efficient care. So if we're working all within the same hospital system, I can see previous notes, I can see notes from other disciplines, I can see their PT notes, etc. Secure sharing of clinical information. Aiding providers to more effectively diagnose patients, reduce medical errors, and provide safer care. Safer, more reliable prescribing. If I'm a provider putting in a prescription and I put in the wrong dosage, the EHRs are built to bring an indicator up and be like, hey, are you sure? If so, please put in why you're putting in this outside of normal range dosage. Legible, which I don't know if any of you have ever worked with a paper chart. This can be a real issue when some providers have terrible handwriting. Complete documentation and accurate, streamlined coding and billing. Enhancing privacy and security of patient data. Improvement of productivity, improvement of efficiency. Cost reduction through decreased paperwork, improved safety, reduced duplication of testing, and improved health. So these are the kinds of things that are contained in an EHR. Administrative and billing data, who their health insurance providers are, their primary, their supplementary, patient demographics, age, sex, race, ethnicity, religion, progress notes, vital signs, medical histories, diagnoses, medications, immunizations, dates, allergies, radiology images, lab and test results. EMRs and EHRs, is there a difference? So we would generally watch this video together in class. Obviously, you can choose to watch this in your own time, but I will explain more on the next slide, the key differences between EMRs and EHRs. An EMR, so an electronic medical record, contains the medical and treatment history of patients in a single practice. So at your doctor's office, in your doctor's clinic. Again, the digital version of a paper chart, it allows the clinic to track data over time, easily identify which patients are due for preventative screenings or checkups. A lot of EMRs have built in like, oh, when this person turns 50, these are the tests they need to be done. Oh, have they gotten their flu vaccine this year? And it'll give us an alert in the EMR when we open it. Check how patients are doing on certain parameters. Are they having issues with their blood pressure? Let's see what the trend has been over the last few years, vaccinations, etc. Monitor and improve overall quality of care within the practice. Versus the EHR, which does all of those things. However, it's a focus on a total health of a patient, meaning that it's built to reach beyond the health organization that originally collects that information and built to be shared. Obviously, with patient permission, moves with a patient from setting to setting. If you're working or the patient is going from a primary care in the same hospital system as the ER, they're going to have access to those charts, which is very helpful for reasons I will explain here in just a second. So let's say the information gathered by a primary care provider tells the emergency department clinician about the patient's life-threatening allergy to a medication so that care can be adjusted appropriately even if the patient is unconscious and unable to let the ED physician know. A patient could log on to his own record and see the trend of lab results over the last year, which can help motivate them to take their medications and keep up with lifestyle changes. The lab results run last week are already in the record and tell the specialist what she needs to know without running duplicate tests. So if I am seeing my PCP and they draw labs, but they're referring me to a specialist, this way the specialist doesn't need to send me to go get labs again because they can see the labs that were just drawn. The clinician's note from the patient's hospital stay can help inform the discharge instructions and follow-up care and enable the patient to move from one care setting to another more smoothly. Now let's learn about promoting interoperability, PI, formerly known as meaningful use, or MU. So what is it? Defined as the use of certified EHR technology in a meaningful manner. It was renamed to PI in April of 2018. To qualify for incentive payments from CMS EHR incentive program, eligible providers and hospitals must demonstrate meaningful use of the EHR. Incentives provided to accelerate adoption of EHR. Now those who do not participate receive penalties in the form of reduced Medicare reimbursements. So the stages of meaningful use objectives were in 3 stages. Stage 1, data capture and sharing. Stage 2, advanced clinical processes. And stage 3, improved outcomes. In February of 2009, the American Reinvestment and Recovery Act was enacted, which included measures to modernize infrastructure as a whole. As a result of that, we had the HITECH Act, the Health Information Technology for Economic and Clinical Health Act, which included meaningful use. By using certified EHR tech, providers and institutions must submit to the Secretary of Health and Human Services information on quality of care and other measures. Meaningful use is built around these 5 pillars: improving quality, safety, efficiency, and reducing health disparities, engaging patients and families in their health, improvement of care coordination, improved population and public health, and ensuring adequate privacy and security protection for personal health information. So the purpose of meaningful use was it was a check on the initiation of EHR. It wasn't so much that you just adopted the EHR, you had to demonstrate to the government for these reimbursements that you were using it in a meaningful way. (2016) was the final year for eligible providers or eligible hospitals or critical access hospitals to begin participation in meaningful use. In 2021 will be the last year that incentive payments can be received. So examples of measures, e-prescribing, query of PDMP, so this is the Prescription Drug Management Program. This is just a program built, it's state to state, where you can check to see if patients have gotten controlled substances within, when the last time they picked up a controlled substance. So it just prevents people from quote unquote doctor shopping. Support electronic referral loops, provide patients electronic access to their health information. So this is generally through patient portals. Report to 2 different public health agencies or clinical data registries. So this would be your state's immunization registry, electronic case reporting, public health registry reporting, clinical data registry reporting, and syndromic surveillance reporting. So I'm not going to test you on the information on this slide. I think that it's just important to have some knowledge of it. So you can see there's a YouTube video here, and actually the photo itself is linked. So in the actual PowerPoint itself, if you're listening to the video lecture right now, you can control click on the photo. It's really dense even to me, and for your purposes as a medical scribe, it's not necessarily something you'll need to have intimate knowledge of, but I would like you to introduce yourself to it. So what? How does any of this pertain to you, the medical scribe? So how this pertains to you, the medical scribe, is how it pertains to you in almost every case. You just need to make sure you are documenting thoroughly. So the most important thing I want you to take away from this is meaningful use or promoting interoperability. We need to make sure that we are fully documenting when things are done, when things are accessed, because that is going to help prove to Department of Health and Human Services that we are using our EHRs meaningfully. You're going to be interacting with the EHR sometimes more than your physician, so it's your job just to make sure that you're documenting thoroughly. So just to reiterate, all of your final documentation will occur inside an EMR or EHR. When it comes to things like meaningful use, promoting interoperability, MACRA, MIPS, and APMs, each clinical area may differ. However, your thorough and accurate documentation will impact how reimbursement is evaluated for eligible providers or the eligible hospital. The great thing about a lot of EHRs is they will prompt you if important information still needs to be charted, but you should not rely on this. Your physician is ultimately responsible for what is in the documentation, but the longevity and success of your career may rely on your talents of thorough charting and understanding of what elements are necessary for optimal reimbursement. Any questions, comments, or concerns, please feel free to reach out.